There are three main types of Medicare Advantage plans you should know about. First, the Health Maintenance Organization, HMO, plans require you to select a primary care physician and get referrals to see specialists, emphasizing preventive care. Second, Preferred Provider Organization, PPO, options offer more flexibility, letting you see any doctor or specialist without a referral, though often at a higher cost. Lastly, Special Needs Plans, SNP, are designed for those with specific health needs or conditions, providing tailored benefits and networks. Each plan has its pros and cons, depending on your healthcare priorities and needs, guiding you towards making an informed decision about your Medicare coverage. Exploring HMO plans. HMO plans, often requiring you to select a primary care physician, typically necessitate a referral to consult a specialist. When you're part of a health maintenance organization plan, your healthcare revolves around a network of designated providers. This means your primary care physician acts as a gatekeeper for your health needs, guiding you through the system and determining when you need specialized care. It's a setup that ensures you're receiving consistent and coordinated care. But it also means you can't just see any specialist you want without going through your primary doctor first. Understanding PPO options. If you're seeking flexibility in your healthcare choices, a PPO plan might be the right fit, as it allows you to visit any doctor or specialist without needing a referral. PPO, which stands for Preferred Provider Organization, is a type of Medicare Advantage plan, designed to offer you more freedom in selecting healthcare providers. Unlike other plans, PPOs provide coverage for both in-network and out-of-network providers. This means you have the luxury of choosing doctors and specialists that best meet your needs, without worrying about whether they're within a specific network. Special Needs Plans Overview. For individuals with specific health needs, Special Needs Plans, SNPs, offer a tailored Medicare Advantage option designed to provide targeted care and support. These plans are a lifeline for those with chronic conditions, institutionalized individuals, or dual-eligible beneficiaries, ensuring they receive care that's specifically suited to their unique situations. SNPs distinguish themselves by tailoring their benefits, provider networks, and drug formularies to meet the distinctive needs of their members, setting them apart from other Medicare Advantage plans. By carefully examining their healthcare needs, preferences, and budgetary needs, beneficiaries can choose the Medicare Advantage plan that best fits them. Understanding these plan alternatives allows people to properly choose the coverage that suits their healthcare needs and priorities.